Hello and welcome to the Clean Bill of Wealth podcast for Canadian doctors. I am your host, Galen Nuttall. Join me as I interview doctors and related professionals and talk about what it takes to achieve wealth in this, the Great White North. Not just wealth as measured by a bank account, but also family, faith, and health. Be sure to go to GalenHelpsDocs.com. That is Galen, that is how my name is spelled, helpsdocs.com, to get access to my free video series where I uncover the top myths about growing your wealth as a doctor north of the wall. Now, please enjoy the show. Hello there. Today I'm interviewing Christine McGinn, who lives in Ottawa and is the CEO and co-owner of Assurance Home Care, which is an Ottawa-based initiative, fast-growing home care solutions company. And what they do there is they provide in-home care to seniors. And Christine has been in the nursing and healthcare industry for the past 32 years, so definitely has a lot of insight into that arena. And in 2018, Christine was recognized by the Canadian Nurses Foundation for Innovative Leadership, also awarded and recognized by the Royal Ottawa Hospital for Mental Health for her contribution and leadership in mental health in 2019. And then also, last but certainly not least, awarded Best New Business at this year's awards put on by the Ottawa Board of Trade and the Ottawa Business Journal. So welcome.
Thank you, Galen. I'm really excited to be here.
Yes, I'm excited to have you too. So it's kind of funny. I don't know if I'll have time to go into how we met, but we kind of met under funny circumstances near where I live. So I live in Belleville, and we met up. We were at an event in the county, Prince Edward County. If any of our listeners haven't been there, they should go for sure, especially when the weather gets better. So what fascinated me about you when I met you was that you're definitely working very hard, building a very important business. Even before I hit record, you were telling me about how you hold events where there's standing room only because people are really, really interested in learning more about what it is you do and how you help the Canadian population. So if you could just give us just tell us like the Coles Notes of like what it is that Assurance does, like what is the problem that exists out there that Assurance is helping solve? I think that would be interesting.
Yeah, so great question. So Assurance Home Care is a boutique styled home care company that offers a wide range of home care solutions for people who want to remain in their home for as long as possible. So everything on the spectrum from simple companionship or assistance with housekeeping, right through to palliative care, end of life, and everything in between. So we have a couple of unique services that differentiate us from other home care companies. And one is we have a gourmet style home delivery meal service, which we're very proud of. We actually hired the head chef from Canoe, which is one of the top 10 restaurants in Toronto. And he was looking for a lifestyle change. So he moved to Ottawa with his wife and applied for our head chef position. So we're very proud of that. So it's all, fresh, whole ingredients and delivered fresh and cooked to the senior stores. That's nice. One. The second one that we're really proud of is, our healthcare system is in a bit of a, I guess it's no surprise that it's in a bit of a shambles. And so we have a care coordination management position, which is a combination of advocacy and boots on the ground family for, say, if you're living out of town but your mom has a doctor's appointment, you'd love to be there, but you can't. So you send a qualified, skilled system navigator from our company in to take notes and report back to the family with the client's permission. Just one of the many things we do, but essentially we will wrap ourselves around that client and be the family member for them in the absence of a loved one.
Yeah, and that's very interesting because, certainly I'm seeing more and more where, there's an aging population and their kids aren't always near home. I'll meet people who live in this area, but they've got kids in Alberta, BC, Western Ontario that can't just come at the drop of a hat for a thing. So that sounds super helpful.
For sure. That's referred to as the sandwich generation.
Yes, exactly. They're right in between. They're still got kids to take care of and parents to take care of. Yeah. And then when do people usually need to be in touch with you? Like what are the things that either happen in someone's life or the stage of life that someone hits to then say, okay, I really should talk to someone like Assurance?
Yeah, well, interesting question again, because you would think it's when you have an illness diagnosed, or you're going for surgery and you want to make sure that things are in place for you when you come home. Not always the case. About 65% of the clients that we see are seniors in that kind of scenario, but there are others. So we deal with the Royal Ottawa Hospital, which is a world-class mental health facility for people struggling with all kinds of mental health issues. And we've dealt with their mood and anxiety clinic, for instance, where a mom who has been in the inpatient program for 3 months, but has to go home at some point to 3 young kids in the home, one of whom has autism, for instance. So we will go in advance of the discharge, working with the along with the social worker, to set the stage for her to have a stress-free transition to the home environment by getting the kids back on a schedule and making sure they're doing their homework and doing their bit to help moms transition. So that's just one example of things that are outside of what people think about in terms of home care. There is a myth out there that that it's just for the ill. To the contrary, we're seeing more and more seniors engaging us proactively to help them access resources for socializing in the community with their peers, for helping them get an exercise program going for them, helping them in the areas that have become sort of onerous for them and then are taxing on their health. So getting on top of those things before they become in a crisis situation.
Well, I noticed, I noticed that part of your bio is that you were recognized for contribution and leadership in mental health. And so I'm glad you brought that up, because I was wondering where that fits in. So I can't help but wonder, I have a number of clients who have children who, are autistic, or, need a level of care, that's top of mind for them. And especially in cases where, that's their only child and they're getting older, and they start to wonder what's going to happen to their child after they're gone. They can do things like provide financially, and that's usually where I fit in, is to help figure all that out. But then there is a level of concern there of, who's still going to be around to help my child navigate certain things, to navigate aspects of life that are extra complicated for them. And is that sort of also where you fit in?
Yeah, for sure. So our care coordinator could act as an advocate for anyone, in that situation, and providing what we really provide for people is peace of mind. Peace of mind that when you're not here, that your child is going to be cared for, even if they're an adult by then. Peace of mind to the sandwich generation, children who can't be there to attend doctor's appointments and tests and procedures for their parents. So that's really what we deliver, and it's highly customizable. So it depends. We look at a person holistically. So we don't just look at what's going on physically. We look at what are the social requirements of someone, and their emotional, how is their emotional health? And we wrap around the services to help them maintain independence, and keep them safe in age and place where they'd like to, whatever that is, for as long as they wish to be there.
Got it. Yeah, definitely peace of mind. That's definitely top of mind for especially the people I'm speaking of, as they're getting older, wondering who's going to take care of their children when they're no longer around. Do they take care of? And I guess one thing we should say, just in case people don't know what the sandwich generation is, what is the sandwich generation?
Okay, yeah, I'm glad you clarified that. So sandwich generation are those, traditionally in the middle age category, like myself, who are taking care of aging parents while at the same time still raising and very involved in their kids' lives. And at the same time, living busy lives. Most people at my point in the life cycle are at the peak of their career. So it's highly stressful. We've got a lot of incoming demands. And so we feel we're sandwiched between them, literally.
Yeah. If a sandwich could have 3 side, not just the top and the bottom, but of the older generation, the younger generation, but also the career on the side, and then the health on the other side.
For sure. That's a beast in itself.
Oh, absolutely. And then so just for you particular, Christine, you have a background in nursing, you've started Assurance, just if you could tell us about what happened to make you say, okay, this is something that I want to do. I want to work in this arena of helping people with this problem.
Yeah, I think initially, I'm very, very passionate about senior care. I always have been, and I think that came from my upbringing, being brought up in a small town with very traditional values. One of the biggest values I grew up with is respect for older people, for elderly people, and calling them Mr. and Mrs. and not dear and honey and sweetheart, which the me generation tends to do these days. So that really started the ball rolling. Then when I was a young adult, my mom and I climbed this local mountain close to our home when she turned 65. And we got to the top and we were standing there. And she said, Christine, when a woman turns 65, she becomes invisible to society. And that actually, that resonated so much with me and really drives my passion for what I do. No one should ever feel that way, that they are not valued and respected and heard and supported. So it's been super important to me from the very beginning. I went on to my very first job I ever had was as a VON, home care community nurse. So my degree actually is I specialized in community health nursing, and then went on to take a position at VON. And you only get one opportunity to see things with a fresh pair of eyes, because over time, experience and age taint your perception of everything. So with those fresh pair of eyes as a young graduate, I really, the very first thing I remember thinking is we ought to be doing better. This is our most precious and incredible resource, our elderly, and yet I felt like the whole system was completely lacking. So this is actually my second healthcare company. I actually had one in the 1990s and early 2000s that only did care management, taking people by the hand and guiding them through the system to achieve their maximum maximum health.
Yeah. Well, I mean, that story is really incredible. I mean, coming from a small town where you in that environment, and I can definitely relate to that, like the town where my dad grew up, and I'd go visit my grandmother, small town, definitely like a senior oriented environment, where everyone's going to church and everyone's sharing vegetables from their farms, like a very different vibe than I feel modern life has taken on, or at least, urban life. And, yeah, that story about your mom saying to you when a woman turns 65, she turns invisible. I mean, it's really, I've certainly had clients. I had a client a while ago in her 90s, and I remember the day things happened. Like, for example, she lost her license at 91 or 92, I think, and that was a huge blow to her freedom. Especially in a small town, like we don't have Uber in Belleville, so to get around became difficult. I think also. For her, certainly there would have been an element, or for anyone, there would have been an element of, sort of like a hit to the self-esteem, right? Like, oh, I can't drive anymore. Like, I'm getting older. I'm not allowed to do these things anymore. And so I think it's fascinating that you saw that issue coming about and your own desire to help solve this problem of starting Assurant. So, what did it look like? I mean, so you say it in a way that makes it sound almost like, oh yeah, I started this company, I started that company. Like for most people, it's like, wait, you started a company, period, much less two, and are having success. Like what is? I'm just curious to talk a little bit about what that leap is like for, going from it sounds like you, and correct me if I'm wrong, like just from nursing as a profession to now I'm going to start a company that supplements or kind of helps fix something that's still lacking in this arena. What was that leap like for you?
Well, it's been a lot of work, a lot of work, but very fulfilling and rewarding, because what really, you can't go into business if you're in it for the money. It's never been about that for me. It's certainly what drives me is just a passion for a passion for what I'm doing, and knowing that our company and our team are making incredible and substantial differences in people's lives. So.
Yeah, and that helps kind of push you forward, knowing that you're making
exactly. It actually makes the job easier.
Yeah, and I didn't tell you I was going to ask you this, but if you could, is there's any way you could think of a specific example? You've given us examples of how people engage, but if you could think of a specific example of someone who has said, thank God I talked to you guys, because now my parents, or now or, I'd be interested to hear like a specific story of how someone uh, was able to call you up and get some help with something they had a problem with.
Yeah, well, I mean, there are several examples. I
Sure.
could go on for 3 days about them,
Yeah.
but I will highlight one
Hmm.
that I got a call from two children, adult children, and their mom had been admitted to emergency because she had fallen in the night, and literally she was crying into the phone, and she said to me, "My mom is going to die if we don't get her out of the hospital." That's what her words were. So I said, "Okay." So I went over to the daughter's house, and she actually lives in a 2-story house, and her mom lives in the downstairs. So her mom has the main floor, and she lives upstairs with a door in between. So it's like a duplex. But I said, I met with them, looked at the home environment, then went over to the hospital, and sure enough, her mom, what had happened was her mom had been admitted to emergency because she had fallen in the night and had a little hairline fracture. When the emergency room staff asked the mom if she had someone at home that could take care of her, she responded and said she lived alone, which was true, but failed to mention that her daughter lived upstairs. And so she got admitted to the hospital. Within a week, she developed the flu. So then her hospitalization was extended. Within 3 weeks, she was bedridden as a result of the flu, developed an embolism in her leg, which is a blood clot, and then got on the list for rehabilitation. So when I got involved, I talked to the social worker right away and said, is there any reason why she can't go home? And I provided information about what the home environment looked like and the fact that the daughter lived upstairs. And the social worker says, we can get her out in 24 hours. So the daughters actually said, and it's not really my doing, but they did say, you literally saved my mom's life. It's a feel-good feeling. I can't take responsibility for it. But you know what I did? And what our team does is connects the dots. Our system is very siloed. The hospital doesn't know what's going on in the home, and they're also busy and understaffed sometimes. So they don't necessarily ask all of the right questions when someone is admitted. And this lady literally should have just been an emergency room visit and a discharge home that night. And so I'm personally proud of that one.
Yeah, for sure. And I mean, I think like from what you're saying, it sounds to me like you said, you connect the dots, and it sounds to me like you're looking at it from like the big picture. Like you said, everyone's kind of in their silos, and, kids maybe don't feel like, or anyone might not feel like they have as much of a say with their own care as they really do at the end of the day. Like, I feel like when I meet a lot of people, they feel like they don't have that ability to ask for more, or I shouldn't say ask for more, but ask for certain things that they need. And of course, like the time with the overworked staff at a hospital, or, if that's the situation, it's limited, it's like, I got to make the most of this time. Can I, how do I get the information I need? And, you coming in from a big picture view could say, oh, this is all that they needed to know to be able to give the go ahead to send someone home. And that's definitely, and it's certainly, I know, like, when I've been in that situation, like, especially like, I had, my daughter was in the hospital for a week a couple years ago, and it was nothing serious, but my ability to I know that my cognitive ability dropped because like such a big part of my brain was so preoccupied with what was going on with her that I was probably working at 40% maybe in the other areas of my life. And probably not making like the smartest decisions around certain things if I had someone else, with that. And I get, like, especially when it comes to this parent in the hospital, and you see, like they said, she's going to die if she doesn't get out of there. She's bedridden now and she can't get out. So that's a very clear story of how you've kind of stepped in. But one of the things I'm interested in knowing is, because this podcast is geared towards medical professionals and specific, Canadian doctors. Is there anything that Canadian doctors should be aware of when it comes to the services that Assurance provides, or home-based care companies provide?
Yeah, for sure. So there is a big push in Ontario to end hallway medicine, and we're all in this together. Every health care provider is working towards that goal. And so where I see an opportunity for physicians and home care providers to work is to do just that. So there are opportunities where a physician knows the medical history very well and the medications that the client is on or patient is on. And then the home care providers know what's going on in the home environment and have intimate knowledge, because caregivers are in there sometimes every day and looking for opportunities to see changes or deteriorations in conditions. So we can work together proactively to get on top of things that arise, before a person has to make an emergency room visit or has to be immediately placed to say a long-term care facility that doesn't exist, and they end up in an alternate level of care bed in the acute care setting.
Yeah, so it'd be to help, and so just maybe in case people aren't familiar with the whole ending of hallway medicine, that's due to just overcrowding of hospitals. Like people are ending up in, is that what that means? Like ending up in hallways instead of actual beds?
Yes, exactly. So it's, there's an increased visit to emergency rooms because people don't have options. There aren't there aren't enough family physicians for everyone. So what do you do on a weekend, on a Saturday night when you have an issue? You go to Emerge. So it's getting overtaxed, our emergency room system. It's also very costly. The alternative level of care beds, it's around $1,200 a night to keep someone who doesn't need acute care in the hospital waiting for a bed. There are better solutions for that we need to access.
Yeah. Well, my kids definitely tend to get fevers at 11 o'clock on a Friday night when there's no other. I feel like that's when it kicks, like boom, like when it's the least likely time to get anything from, the family physician and ending up in the ER and everything. Yeah. Okay. Very good. So a little bit of collaboration between the primary care and can help alleviate that, help work towards that ending of the hallway medicine, which, it's definitely, I won't go into it, but, I've lived in 3 different countries, so United States, Venezuela, and Canada, each with different approaches to healthcare. And there's certainly pros and cons to each. And I remember, when I used to live in Venezuela and I would meet Canadians, they would say, oh, Canadian healthcare. And yes, absolutely. I'm a big fan of everyone having a certain level of care, and there's certainly huge gaps in the United States when it comes to healthcare. But obviously, there's huge places to keep continuing to make improvements in the system where, in the town of Belleville, every time a new family physician shows up, it shows up in the paper, but there's always something at the bottom that says, how you can actually get a family physician, which is not usually by calling them. It's usually like people from the wait list. We have a nurse practitioner clinic in Belleville to help with some of that overflow of when people can go meet a nurse practitioner if they don't have a family physician, and they can still get a very high level of, care. But yeah, certainly it's good to know that that you're out there doing other things to help alleviate this issue and spread things out a little bit more than having everyone go to the same place for all their issues of going to the emergency room, ending up in a hallway on a stretcher, that sort of thing.
That's right.
Very good. Awesome. Well, thanks for joining me today. What I'll end is so last thing I wanted to make sure I got out there was, what is the best way for anyone to learn more about what you do? Is there a website? Is there, what's the best way for people to learn more?
Yeah. So you can visit our website, www.assurancehomecare.ca. You can follow us on Twitter. We're on Instagram, and follow us on Facebook as well.
All right. So Assurance Home Care. So that's ASSURANCE homecare.ca.
That's correct.
Perfect. Awesome. Well, thanks so much for joining me today. I learned a ton about what you're doing, and I can see why, as you mentioned before I hit record, that you hold events, and sometimes it's standing room only because there's so many people in the sandwich generation, like you're saying, or people who are older, who are, the parents of that generation, wondering what their options are when it comes to getting the healthcare they need at home or, transitioning in and out of the hospital.
Yeah, it was a pleasure.
Sure thing.
All right. Thank you for having me.
Take care.
You too.
Bye. This is your host, Galen Nuttall. Thank you for joining me at A Clean Bill of Wealth, the podcast for Canadian doctors. I hope you enjoyed the show. Be sure to check out my free video series at GalenHelpsDocs.com, where I debunk some of the myths around wealth generation for Canadian doctors. Take care and talk to you soon.